This is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina. I'm a specialist in chronic and rare diseases. It's been a while since I've visited with you because I've been focusing on taking some time off and also working on the coronavirus. And you can see that we've got some YouTube videos about that. I think we're going about it in the wrong way. We're not doing a complete infection control plan, but you can watch the video and learn more about that. So back to the issues of people with rare and chronic diseases. We know there's 10 million of them. That's quite a good estimate. 80%, according to a recent poll, said they are not getting adequate treatment because doctors are reticent to prescribe high doses of opiates. And now we're having problems with pharmacies. So people in the JAF organization have applied for a name. We have a new name for a national organization called the National Pain Council. So under the National Pain Council, we are going to try to organize by affiliates a lot of the pain groups under one umbrella so that we can speak with one voice. It's not going to be an active organization. The steering committee is going to help bring ideas from the various affiliates to Washington, possibly hiring lobbyists. Over the past 4 months, we've been having a very severe problem with pharmacies no longer agreeing to fill prescriptions for pain medicines. They can't do that. If I write a prescription for a pain medicine, a particular medicine, dose, and how often it's taken, and the prescription is to start tomorrow, and I give a 30-day supply with refills, then my intention is that this is going to be treatment over the long period of time. If I give a prescription for 15 days, at the end of 15 days, the prescription is over. Only licensed medical people can write prescriptions and make diagnoses. No one else can do that. So the question arises that if I give a 15-day prescription for something, let's say penicillin, and the pharmacist thinks it's too much, and the pharmacist says to the patient when they come in, I'm only going to give you 8 days because penicillin's dangerous and you might get sick. The pharmacist cannot legally do that without a medical license because it's basically in the hubris of creating a prescription. The prescription has start and end dates. Now, if a pharmacist really was concerned because the patient's having a bad reaction, then the pharmacist should generate a no-fill document with the prescribing person, physician, nurse practitioner, or PA, physician assistant, and then file that, give a copy to the patient, and file it with the Board of Pharmacy. That's not what's going on. We're working on a document that should be up on our JAF website soon called Excuses Pharmacists Make. We have 40 excuses we've gathered from the internet and from Twitter about why pharmacists are denying prescriptions. The most common one that we've run across this last week is refusing to fill a prescription because the doctor's out of state. The reason a lot of people are going to doctors out of state is because the doctors in state are drying up and there aren't any. So people are having to drive 3 hours to see a pain specialist to get their medicines. Then the pharmacists turn around and punish them and say, oh, your doctor's too far away, we can't fill that prescription. If the pharmacist really is concerned about a doctor being far away, then they have to call up the prescriber and say, look, I'm concerned that you're too far away, and then have a conversation on the telephone about the doctor in another state. And then if they decide, the pharmacist decides to kill the prescription, they're doing so on their own without a medical license. Now, we are proposing with this national organization we're going to try to put together. So if any of you people have affiliates and you want to contact us, we have a new We're just, informal here. We have a new email, jatheducational@gmail.com. And you can email us. And if you want to become an affiliate or talk about becoming an affiliate, the goal is to have a national organization with representing a lot of people. When you go to Washington, you can't say, there's 6 people in my group. You got to go to Washington and you say, I've got 50,000 people in my group, and they'll listen. Because they don't want to pass laws for 4 people unless they have to. They want to pass laws that are going to benefit a lot of people. So we are proposing at the state level and the federal level that anybody who's disabled, anybody who is covered by federal funding, that is Medicare, Medicaid, or contractors of the same, that all prescriptions are to be filled. If I write a prescription for somebody, I expect it's going to be filled. I also respect the pharmacists. They are terminal degree professionals to give me a call if there's a problem. And a pharmacist I deal with do call me, and every 3 or 4 months we have a problem, we talk about it, and we decide what to do together. We come to a consensus. We've never had a difference of opinion where I said I disagree. If that's the case, it has to go on a no-fill report that currently doesn't exist. If you check with the Board of Pharmacies about pharmacists having the right to not fill prescriptions, they pretty much all say vague things like the pharmacist can use their judgment. And they can, but it needs to be with the prescribers. What we're seeing almost 100% of the time is refusals to fill and doctors not being called, or nurse practitioners, whoever's written the prescription. That is unacceptable. That then enters the territory of practicing without a medical license. And my understanding is in Texas, the Texas Board of Medicine was sending out cease and desist orders to pharmacists. We're still trying to confirm that, and if anybody has any information, jatheducational@gmail.com. So not only are people with these horrible, intractable, rare diseases, CRPS, interstitial cystitis, pudendal neuritis, botched surgeries, terrible post-traumatic automobile accident neuropathies, the list goes on, which can be accessed by Googling medium catalog Klein, and you get a catalog of rare diseases. So in addition to losing their doctors, 75% of doctors in the United States are no longer prescribing opiates because of the CDC regulations, not regulations, but guidelines, that basically said opiates are not the first drug of choice for chronic pain. Well, the people at the CDC have never been in chronic pain. I don't think they realize what it is. Deborah Dowell, who was one of the writers of the CDC guidelines, described chronic pain as low back pain and sore hips. That's not what these diseases are. These are systemic diseases with fevers, intermittent fevers, with the inability to sleep, with the inability to make love, with the inability to get off the couch, with the inability to participate in their children's school activities. One woman had to lay on the couch and instruct her 8-year-old how to make his lunch. As hard as she tried, she just couldn't get up. She was in so much pain. I've had 34 patients with these rare diseases, and I can tell you that the most wonderful, most rewarding thing in my career has been to put these folks back on the medicines they were on previously and adjust the dose so that their lives were restored. And all 34 had their lives restored. And now it's being wrecked again by pharmacists who, one pharmacist said to a patient of mine, a pharmacist at one of the mail order pharmacies. They have pharmacists there too. They don't talk to you very much and sometimes refuse to talk to you. And this is a CVS Caremark. The pharmacist finally got on the phone with the patient after denying her pain medicines flat out. And she has adhesive arachnoiditis, an inflammation of her spine from contaminated steroid injection back in 2012 from Boston. Her life was ruined. She was a physical therapy assistant, a CNA, and she wanted to go to nursing school to become a nurse practitioner, and she couldn't. Now, after her life was restored, she was able to do lots of activities that she wanted to do, raise her 2 kids, and participate in church activities. But then she got cut off. All the pharmacists in her part of Kentucky decided that they weren't going to take any prescriptions from doctors who were out of state. So what? That's not a valid reason. They just arbitrarily decide. This reminds me of the days when I used to see signs up that said, "We reserve the right to refuse service." She's a disabled person. She has a civil rights action against these pharmacies. But back to the pharmacist at CVS Caremark. Finally, he said, "We're not going to fill your prescription. Let me tell you why." And he starts yelling at her on the phone. She got enough problems, and now the pharmacist is yelling at her. She needed 2 fentanyl patches every 3 days because of the severity of her disease. And he says to her, "If I put 2 patches on my arm, I'd be dead." That's our druggist helping out people. This has got to stop. Anybody that wants to contact us to help us with this national campaign to get a federal law passed, you fill the prescriptions, period. And if you think something's wrong, we'll have a mechanism. Should be done at state levels too, but mainly to protect the class of disabled people who are being denied medical treatment. So with that, I say good evening, and I will see you next time. This is May 16th, just to keep things straight, 2020.